Now, you are ready to embark on your first ketamine therapy treatment. I am Dr. Leal, and before we get started, I want to tell you that I am proud of you for taking the steps to focus on improving your life. Dose acclimation. Let's discuss dose acclimation. During the absorption phase, which involves keeping the saliva in your mouth for 15 minutes without swallowing, you might feel a bit unusual, almost like a chipmunk with your cheeks full. Use this time to relax and ground yourself in preparation for your session. It is crucial to begin with a lower dose, allowing your body and mind to gradually get used to the effects of the medication. The initial sessions are part of what we call dose acclimation. Our aim is to smoothly introduce your body to the sensations of ketamine. These initial sessions involve lower doses and are termed medication-enhanced meditation. You may experience feelings of bliss, empathy, compassion, and connection, accompanied by a mild euphoria, while maintaining full awareness of your body. Take this period to familiarize yourself with these new sensations. These sessions will be less intense compared to typical therapeutic sessions. The goal is to adapt to the medication and understand its impact before considering any dose increase. As you're undergoing the treatment at home, we will start with smaller doses and gradually progress. Your first session might feel more like a meditative experience, and that's okay. The idea is to dip your toes in the water first to get a feel for the temperature before cannonballing into the deep end. As we gradually increase the dose, you may notice more dissociative or mild psychedelic effects. Even at higher doses, you will remain aware of your thoughts, your environment, and your sense of self, while your nervous system shifts into a deeply relaxed state. Importantly, the therapeutic benefits of ketamine do not depend on having a pseudo-psychedelic experience. Research shows that dissociation itself does not predict outcomes. The real benefit comes from the neuroplasticity, the brain's ability to form new connections, and those changes can occur even when the experience feels subtle. Consistency is key in the first month of treatments. When working with neuroplasticity, it helps to think about it like working out a muscle in the body. If you go to the gym once every few weeks and lift some weights, you might feel confident and good the days you go and possibly the days after. But without consistency, you won't build the strength or endurance you're aiming for. Ketamine therapy works in a very similar way. One session may bring meaningful insights or a sense of relief in the days that follow. However, without consistency, the benefits that occur during the neuroplastic window after each session won't have the opportunity to turn into new habits or lasting changes. The beauty of neuroplasticity is that it strengthens and grows over time. While once or twice a week may feel like a lot in the beginning, the goal is to eventually move you into a sustainable maintenance routine, where healthier patterns are established and help support long-term symptom relief. Open the brain box. Before beginning your treatment, you will need to take your blood pressure with the provided blood pressure cuff you received in your brain box. If your systolic number or the top number is 140 or above, try taking it again to see if it lowers it, as it could have been an inaccurate reading. It's very important to be sitting comfortably with both your feet flat on the floor and your legs uncrossed to get a correct reading. If your blood pressure is still high, you need to wait until you can get it down prior to beginning your treatment, as ketamine can increase blood pressure. Please be sure to record your blood pressure in your member portal under the metrics section prior to each session. Inside the zipper flap, you will have received troche lozenges, which are small waxed squares, or rapidly dissolving tablets, RDTs, which are like small sugar cubes. Make sure to take the ondansetron or the anti-nausea medication about 20 to 30 minutes before your intended start time. Begin by sitting upright whenever you're doing the session. Pop one troche lozenge out and put it in your mouth. Move it around your mouth to generate some base saliva. Then, with your front teeth, begin to bite or chew the lozenge until it becomes liquefied. The idea is to dissolve the medicine as quickly as possible to ensure maximum absorption of the full dosage you're taking in the allotted time you're holding the saliva in your mouth. It shouldn't take more than 5 minutes to completely dissolve the troche. Once fully dissolved, you will be holding the mouthful of saliva for approximately 12 to 15 minutes. The rapidly dissolving tablets, or RDTs, will dissolve almost instantly. When it comes to taking the medication, the psychedelic effects you should experience occur from the oral absorption. This is a great time for you to relax, think of your intentions, and center yourself for the journey you're about to embark upon. During this time, you will be gently swishing or moving the saliva around in your mouth. Be sure to have a spit cup handy, whether or not you will be ingesting the medicine after the absorption stage. When it comes to ingesting the medication or spitting it out, we always recommend that if this is your first time, please use the spit cup method. Ingesting the medicine will increase the duration and sensation of your experience. If you've already gotten used to this process and you want to increase the duration of your treatment, it's okay to ingest the medication after 15 minutes. Just be aware that it will take much longer for you to return back to your normal baseline. Those who have chronic aches and pains may benefit from ingesting the medicine, as it can provide temporarily pain relief due to its analgesic effects. Avoid trying the ingestion method until after your full dosage discovery sessions to gauge how you feel from the experience. Time of day. What time of day should you do your sessions? Many people wonder what time of day is right for this, and it really depends. If you have the day to yourself, almost like a spa day, then try to do it in the morning. This way, you can experience the rest of the day afterwards in a very calm and relaxed flow state, where you can begin to implement new habits and break old unhealthy ones. If you are working or have responsibilities that day, evening time is preferred. Just remember, if you ingest the medicine, budget a little bit more time, around 3 to 4 hours, so that it gives your body enough time to return to baseline. About 50% of people find it helps with sleep, and others find that it interferes with it. It's important to figure out how your body responds so you can properly prepare for your future sessions. Safety tips. Make sure you use the restroom beforehand, as ketamine is a diuretic, so it can make you feel the urge or need to use the restroom. The biggest safety concern here is falling, as ketamine interferes with your motor skills. Be sure to have your peer support person readily available and nearby to help you get up to use the restroom after your session. Make sure that you keep all of your pets, kids, and distractions away to ensure that you have the experience for yourself without interruptions. Lifestyle protocol. The days leading up to your first session are very important. Start detoxifying the body and mind, getting good sleep, improving your nutritional habits, and getting some activity and movement. All of those things can help you be fully prepared to optimize the benefits from your treatment. If you have any medications prescribed by a different doctor, continue adhering to those instructions. If you're taking as needed medications, if you're able to, try to skip the dose from the day of treatment. Things like stimulants and benzodiazepines will lessen the experience. After receiving your medication in the mail, please read the instructions carefully. The dosage instructions were custom designed for you from your prescriber. If this is your second or third time receiving a package, read the instructions again, because they may have changed. Do not drive after your session. You must get a full night of rest before operating any kind of heavy machinery. It's definitely important to hydrate, but try not to drink water for about 1 to 2 hours before your treatment, so you don't have the urge to go to the bathroom. Try not to eat food for about 3 to 4 hours before your treatment. This will help prevent unwanted side effects of nausea and upset stomach, as well as better absorption and potency of the medication. It's very important to keep the meals light all day. Stick with some salads, lean meats, leafy greens, and nothing fatty or sugary. Music, setting the container for your journey. Music is one of the most important parts of your ketamine therapy experience. It actively guides the journey. Music helps shape where the mind goes and how the experience unfolds. Headphones are recommended for the most immersive effects, and to reduce distractions. In the treatment preparation model in the app, click on the music section. You will also find links to the playlists in each treatment module. Before your session, make sure you've downloaded the playlists to your device so that there are no disruptions during your session. Place your phone on Do Not Disturb so calls or texts do not disrupt your experience. If you're using Spotify, go to your settings, click Playback, and move the crossfade over to 12 seconds so the music flows smoothly from one track to the next. It's also very important to use the premium version of Spotify so commercials do not interrupt your session. If you do not already have premium, Spotify allows a free 30-day trial. Creating the container. Before beginning your session, take a few minutes to intentionally create a safe, comfortable container for your experience. This is your space for healing. Many people find it helpful to use a weighted blanket to create a sense of grounding and security. Aromatherapy can also be supportive, such as essential oils or a diffuser with calming scents like lavender or eucalyptus. But please do not use any lit candles for safety reasons. Adjust the lighting so it feels soft and soothing, and arrange pillows and blankets so that your body feels fully supported. Creating a thoughtful container helps signal to your nervous system that it's safe to relax, let go, and receive the benefits of the treatment. Trust, let go, be open, let the music take you. Please always start with all of the Better You playlists before trying other playlists. They are specifically designed to align with your treatment sessions and help you get the most out of each experience. Emotional processing and integration. During your treatment, it's common for some emotions to come up. The nice thing about this treatment is that most of the time, the emotion that you feel isn't as subjectively charged as it was perhaps before, allowing you some time to reflect and observe what you're going through rather than feeling it profoundly. You are able to see it almost from an outside perspective. If you're going through something, let that emotion come up and try to process it in this more reflective state. Sometimes you have to be tested to have a testimony. Remember, no two sessions will feel the same. If you feel like you're not having your best day and it's hard to redirect, you've tried the breath work, you've tried the meditation, the intention setting, and the journaling, and you just realized that you feel extra stressed out, anxious, or just uncomfortable, it's better to just wait until the next day. We have many relaxation techniques to help you feel more grounded and comfortable. Check them out in your member portal. We are here to help support you on your journey. The greatest journey is that of self-discovery.